Dig a little deeper now into what you just heard about this health care bill that's pending. Joining us from New York, two of the five, Kimberly Guilfoyle and Juan Williams. Kimberly, you just heard the senator. What's your take?
You know, I think they're making some really compelling arguments for the party to come together and do this. And as you see, the GOP is ready for a showdown if that's what it's going to take. I think the expectation level is not high here. So if they, over-deliver, it's going to be good for them because they've definitely under-promised thus far. You even see the president calling out in a nice way, in a charming way, Rand Paul today saying, okay, enough is enough. We have to get this done. It may not be perfect, but it will repeal Obamacare and essentially get this ball rolling so that they can achieve the things that they promised the American public and the electorate that delivered them the Oval, the House, and the Senate. So enough is enough already. This could be a big win for the president, and it seems like it just might be the, kind of like the surprise that no one expected that they would pull out.
Yeah, here is the president's tweet that you mentioned. Rand Paul is a friend of mine, but he is such a negative force when it comes to fixing health care. Graham Cassidy bill is great. Ends Obamacare. Juan, the criticism of this is that it does not cover as many people and that some states would have some leeway. You heard Senator Thune say that there is a provision in here that prevents that they have to have an affordable alternative, that they can't be raising rates for people with pre-existing conditions, etc.
Well, but there's no guarantee, and so that's the issue. There's no guarantee, and as you point out, the number of uninsured went up under the previous incarnation of this bill, and it's expected to even go higher now because, again, everything goes to the states. So it's a matter of state control, which is a key principle for Republicans. That's fine, but when you look at the realities of the bill, you say to yourself, well, if fewer people get covered, there are fewer of the kind of protections for consumers of health care in the country, and there's greater worry as to what individual states may do as they choose, for example, not to offer coverage of pre-existing conditions as a requirement for insurance companies to do business in their state. So that's the worry, and of course then you come to that's where the Jimmy Kimmel thing comes in, with Kimmel saying there's no guarantee that his kid with a heart condition would in fact be saved unless his dad's Jimmy Kimmel and has Jimmy Kimmel's riches.
Yeah, I think it will cover pre-existing conditions. There's nothing that the people aren't trying to be mean-spirited and not perform operations on hospitals, on children in hospitals that come in need. This is about doing something that is comprehensive reform that ultimately is going to improve upon Obamacare. Nobody is saying that's perfect. The one thing I think that's problematic, and the Republicans, why they have a little bit of egg on their face, a little scrambled egg, is because some of the governors, at least 5 of them, are saying, hey, we're not into this because we don't want to manage this behemoth and this government-managed health care at the state level. But, they're going to have to get it together because constituents don't want to hear this.
Juan, you think it's going to happen?
Do I think it could happen, Brett? Is that what you said? Mm-hmm. Yeah, of course. I do think it could happen because I think they're so close. I mean, the problem here from my perspective is just looking at it politically, the patients on Code Red and Republicans are saying, and President Trump is saying, I want to win. That's what's most important to me, is that politically I'm embarrassed at the fact that, as Kimberly said, we have the House, the Senate, and the White House. We promised to repeal and replace, and we haven't done it. And so now they're pushing this, but it's not a better bill.
Yeah. Kimberly?
Well, I think the president wants to provide excellent health care choices for all Americans. This isn't about political wins. It's about doing the right thing for the American people. That's why they put him in office.
It would set the table for tax reform if it does go through. We will follow it all. Kimberly, Juan, thanks.